Hey guys, it's Victoria Taylor with InnoVaTe, a Vermont PBS podcast where we learn all about cool innovations in Vermont. Today we're going to check out ThinkMD, a benefit corporation with a mission to expand global access to healthcare. ThinkMD aims to provide tools to help save the lives of children through their platform MedSync, which puts simple diagnostic tools in the hands of frontline volunteers around the world. Let's go hang out with Barry Finette, the founder, and find out more. Hi Barry, I'm Victoria Taylor.
Nice to meet
Here,
you.
really excited to interview you for InnoVaTe for Vermont PBS. And so ThinkMD's kind of first product is MedSync. And so MedSync, it basically allows one source of medical information to empower many volunteers.
It's exactly right. Because children are dying mainly because there's no access to healthcare and nobody can tell if they're sick or not. So if we can put in the hands of people who are completely unskilled, living in areas where there's no healthcare specialists, no healthcare infrastructure, well, the ability to determine if a child is sick and then automatically give them recommendations for treatment. And we're hoping that we can change the balance of that and change that paradigm in order to have less children dying of preventable diseases. A big challenge from a group like UNICEF or other international NGOs like Save the Children. Ministry of Health are not really supportive of providing community healthcare workers or unskilled workers the tools they may need to treat patients because, well, they're considered to be unskilled, and how would they know if a child is sick or not? So we don't want to put antibiotics or rehydration treatment or other things in their hand. So if we're able to demonstrate that we can provide the skill set to these workers and it's pretty accurate, then that would really able to allow them to pass all these laws and support that and get the funding to support putting these tools in the hands of these workers.
Was there a specific incident that really inspired you to create MedSync?
When you unfortunately have a child die, you know, it's tragic, obviously, on every single level. And as a physician, you always feel frustrated, what could I have done? And there are times you just can't do anything. But when you're working in countries where the infrastructure and the healthcare system is just so limited, and you know that I could cure all these kids if I had all the resources that I needed, you know, that is just incredibly sobering and difficult to deal with. So you say, well, there must be something I can figure out how to do, or at least we'll try. And so this is where we're trying. The idea of this has to be as simple as possible. And there has to be some degree of language simplicity as well. Everything will be country specific. So in this case, we're showing Ecuador. And once we're connected, we'll be able to demonstrate how many users are using it in the country. And this is kind of showing that there's all these different languages that we have to adapt to. So we have English now and Spanish and French. So one of the things that you want to find out is this: why is a child coming and being seen? Is coming in for a cough or diarrhea? We're interested in the location that it's being done. Putting a child age in, we can have them type, but we've been able just to develop a little tool that just allows people to move through it pretty quickly.
That's really clever.
And gender and HIV, all these statuses are really important. And if they cried, do they have tears? Oh, okay. And when
dehydration.
For dehydration, exactly. See, you're ready to go. You're totally ready to go. Put you on the street.
Oh my goodness, I don't know.
No, you don't. You're ready. And then here's really one of the two trickiest parts: is how do you teach somebody who's unskilled to actually say how fast the heart is beating?
Right.
We've actually developed this type of way that just listen to a heart as well as feel a pulse, and they can just basically they tap on this every time they feel a pulse. And what happens is it automatically will generate a heart rate.
That's amazing. I was going to suggest like doing a wearable, but this is so infinitely simpler.
And it's the same way for breathing. Every time a child breathes in, you just hit it. And after 5 times, we'll able to calculate the respiratory rate.
Oh, wow.
So these two factors are really probably the most important, even in the physical exam findings.
Yeah.
And then what we've done, because we make it into a self-learning type of platform, we have embedded videos and pictures to teach people. This is something called a MUAC, which is a way that you can screen for children who are malnourished.
Okay.
And if they're not sure exactly how to do it, this is a video that shows them how to do it. And
so
if they
you
have
a piece of paper with different gradations.
Right, and depending on how you measure the circumference of the upper arm of a child and how thin that upper arm is, actually tells you very accurate how malnourished that child could be. The other thing is how the child's breathing. So from a physical exam point, if a child is breathing and their nostrils are what we call nasal flaring, and it looks like this, and they can just push yes.
What does that nasal flaring indicate?
That indicates a certain degree of respiratory distress.
Okay.
If you see a child breathing in that hard, that their chest is moving in, clearly that's a sign of significant respiratory distress.
Right.
So this just gives you an indication of the teaching part of it and the learning capacity and the assistant tools we have in it. Once those are done, and we find it takes 10 to 15 minutes after we teach people to use it, then basically they're able just to push an assessment button. And what the platform does is determine if the child's in respiratory distress and to what degree it is. We also estimate the risk of infection. And then you push another button and then it gives you the treatments that you would recommend based on those findings. And so testing this is kind of challenging. How do you test if it works?
Right.
So the way we've been doing it is we've tested in 4 different areas here at the University of Vermont and in Bangladesh, Ecuador, and Peru. And what we've done is put this in the hands of unskilled users and then have them see patients and then compare the results they've acquired using this to the doctor seeing the same patient, either a local doctor or one of the doctors who are helping me. And what we've been able to find is that the correlation is over 80 to 95% of the assessments that the doctor is getting correlates with the person who's unskilled seeing those child.
That's amazing.
So we're encouraged that what we're doing is accurate and robust. The other effects they could have, one is all the data that is acquired, public health data, is stored. The device doesn't need an internet to be active or fully functional, but we can download the data once it hooks up to an internet. So that provides all this epidemiological public health data that can be used by the regions that the patients are in.
That's really exciting. And so for your vision for MedSync, it's pretty new, but where would you like to see it end up?
I mean, our goal is to try to get this in the hands of as many people globally as we can possibly can. Now, as a company, we wouldn't be able to do that, but putting it in the hands of those who can then implement it is really the steps that we would need to go through, whether it's a government organization or a non-government organization as such.
The kind of that spark, that idea to build it, do you feel like that was particularly easy because of the environment that you work in?
You know, Vermont is a place where you can think and bounce things off a lot of different people and have access to people, and plus the culture. The culture of people here. They're always interested, they're socially minded, they're willing to do things that are out of the box, so to speak.
This is incredibly exciting, and I really hope that a lot more people get involved, become supporters of MedSync and ThinkMD, and that the app just continues to grow.
Well, thanks. Thanks again for everything.
Thank you, Barry. Take care.
Yeah.
Hey everybody, thanks for tuning in to InnoVaTe on Vermont PBS with me, Victoria Taylor. Today I learned that technology and innovation are changing the way we're able to provide healthcare at a global level. Unique platforms like MedSync are placing valuable, life-saving tools into the hands of workers who can make a difference. To learn more about Barry Finette and ThinkMD, visit their website at www.thinkmd.org.